We're back with the latest on the Ebola outbreak in Central Africa. The World Health Organization says there are now more than 500 suspected Ebola cases and 139 suspected deaths. But officials still believe the risk remains low on a global level. Even so, the U.S. has now restricted entry for people without U.S. passports who have recently been in the Democratic Republic of Congo, South Sudan, or Uganda. Secretary Marco Rubio was just asked about the growing concerns surrounding Ebola in the wake of the U.S. backing out of the World Health Organization earlier this year. Here's how he responded moments ago.
The World Health Organization has unfortunately not done well around the world. I think they failed miserably during COVID. They covered for China, and that's how we're getting out of it. That said, we're going to work with anybody who wants to fix that problem. Our number one objective on Ebola, before anything else, and we think it's terrible what's happening there to the people. We've been very involved with DRC on the peace deal with Rwanda and so forth. But our number one thing has to be we can't have it affect the United States.
For more on this, we're joined by Dr. Mesfin Tessema, Global Practice Lead for Health Programs at the International Rescue Committee, and the IRC has teams on the ground responding to the Ebola outbreak in both the Democratic Republic of Congo as well as Uganda. Doctor, thanks so much for taking the time. What are your teams on the ground seeing? What kinds of conditions are they dealing with right now?
Thank you for having me. Our teams are on the ground in Ituri and the neighboring provinces in Eastern DRC. And we have seen quite a large number of cases that are reported from the communities and people seeking treatment, of course. And, we are more than almost a month since a first suspected case was reported. So really, we are seeing quite a large number of people who are suspected of, contracting the virus and concerned about, regional spread.
Now, this outbreak involves a rarer strain of Ebola that has no approved vaccine currently available. And health officials say this outbreak may have been spreading undetected for weeks before it was identified. How much more difficult does that make containment efforts and the ability to catch the virus before it spreads further?
This outbreak is happening in a place where there's already active conflict and people have been displaced because of that. And it's also a mobile population and porous border, across to South Sudan as well as Uganda. So that's the reason why, it was late to detect this outbreak. And by the time we know, and it's been confirmed, that there is quite a large number of people who have been infected. So, at this moment, our priority is really to protect health services, ensure that healthcare providers can continue to provide care. So make sure that they have protective equipment, including like gloves, Google, and, sanitary, clothes. At the same time, ensuring that we engage communities to be able to identify, isolate and also trace, contact that have come in contact with these cases. So that is a priority, and our team on the ground is really working around the clock to make sure that those supplies for the healthcare workers arrive on time and they continue to go out to the community and communicate and ensure that, traditional leaders are involved in the containment effort. So we have significant experience responding to Ebola, both in DRC as well as in West Africa. And by isolating cases and ensure communities are involved, it is possible to control. But in active conflict zone, it will take time to control this outbreak.
And this is a very scary virus, I think, for most people. We all remember that 2014, 2016 outbreak. Some experts and aid groups are calling this, though, the first major outbreak of the post-USAID era. The U.S. has also withdrawn from the World Health Organization, that happening under the Trump administration. How has that impacted the response to this outbreak and the resources you have to try to contain it?
So many organizations, including the IRC, has experienced, funding cuts, across the board. That's started even just before 2025. So really, this outbreak is coming on top of, funding disruption. And of course, that limits our ability to quickly mount a response and including, putting team on the ground and setting up surveillances and bringing, infection prevention control, devices and testing the treatment. And of course, as you noted, there is no approved vaccine or therapeutic for this one. So, this is a time for solidarity and be able to respond with speed. I think every day, every hour counts and makes a difference whether this outbreak can be brought into our control. So what we have learned from West Africa and DRC is that if communities are engaged quite early and healthcare workers are protected with the right equipment and essential services are sustained, it is possible to control outbreak like this. However, we must note that, we are working in a place where there is affected by conflict, mobile population, and time is the essence, and it might take a while. That is our concern for us and for our team.
It's clearly a challenging moment for people in this region. Dr. Mesafin Tessema, thank you very much for joining us and for the efforts of your team at IRC.